Good morning, everyone, and welcome to the Munson Healthcare COVID-19 press conference. Today is Tuesday, August 31st, 2021. Next slide, please. Today, I'm pleased to be joined by Dr. Christine Nefsey, the Chief Medical Officer for Munson Healthcare, and you'll also be hearing from Lisa Peacock and Dr. Jennifer Morse, two of our leading local health department experts. As of note, Wendy Hirschenberger from the Grand Traverse County Health Department is unable to join us today. So if you do have any questions for the Grand Traverse region, feel free to submit them still, and we'll see if we can still try to get you some answers. And my name is Diane Mihalik. I'm the Chief Marketing and Communications Officer for Munson Healthcare, and I will be your host today. Next slide, please. So without further ado, we'll get started with the general report from Dr. Christine Nefsey, the Chief Medical Officer for Munson Healthcare. Welcome, Dr. Nefsey.
Thank you, Diane. All right, so going into our numbers, you can see here the raw numbers of our cumulative cases over the course of this pandemic, but I really want to draw your attention down to our regional diagnostic test numbers. You can see here on our 2-week rolling average, we're at a 9.4% positivity rate, and over the last week, we're at a 10.7% positivity rate, so quite high. And certainly trending in the direction we would not like it to trend in. It is going up on a daily basis. Next slide. And you can see here also that reflection in our hospitalization numbers. We continue to fluctuate in the mid-40s for hospitalizations across the Munson Healthcare system. Next slide. And there you can just see the graphic representation of our peaks and valleys, and here we are heading back up that slope. Next slide. That is trending along with what we are seeing in the rest of the country. So you can see here, the country as a whole is also in a surge, so those numbers continue to go up. Next slide. And there you can see a color-coded map of where the highest cases per 100,000 in the last week are. So, still a concentration in the southeastern part of the country, as well as in the Mountain West region. Next slide. Here's our report out on the number of people in our region who have completed their vaccination. So we are at a 59.5% completion rate. Still kudos to Leelanau County with some of the highest vaccination rates in the state. Next slide. And I do want to reiterate what most of you probably already have heard, that the Pfizer vaccine did get full FDA approval after being under an emergency use authorization for the last 6 months. So what this means really is simply that it's got full authorization from the FDA. So they have done a complete study over the efficacy as well as side effects and safety aspects of this vaccine, and it did receive full approval for adults 15 and up who can get that vaccine. Next slide. The other news on vaccines is, I think most are aware that our vaccine records in the state of Michigan are in a registry called MICR. Before, you would have to go to your physician or to the health department to get a copy of your vaccine, but now adults can actually log on to that website and get their own shot records. So that will be helpful as we continue to ask for, more places continue to ask for evidence of a vaccination. You now do have access to your own medical record as far as immunizations go. Next slide. I do want to talk a little also about the news that just came out about a third dose. So there is a recommendation now for those who are immunocompromised that they get a third shot of the Pfizer vaccine. And that is just based on some newer studies and evidence that show that people who are immunocompromised, whether through a naturally occurring disease or maybe medications that they're on, tend not to have as strong as an immune response from the first 2 doses of the vaccine than your average person did. So they are recommending that people who are immunocompromised actually get 3 doses of vaccine in order for them to have an adequate immunologic response and antibody response to this virus. This is a little different than what we're hearing about a booster shot that may come later. So just to be clear, there is a recommendation now for that 3rd shot for people who are immunocompromised. The booster shot has been talked about a lot. It has not yet received clearance for that booster. But what we're saying is, just like with other vaccines, you know, you get a couple of measles vaccines, you get a tetanus booster every 10 years. You know, at some point, often the immunogenicity of these vaccines will wane a little bit. And so what they're just looking at here is a 3rd booster shot at some point after the initial series adequate. We do expect that that will be a recommendation. It has not been approved yet, but just so people understand, that's where we are. As soon as we hear about that approval, we will let you know. And we are in the process, along with health departments and primary care clinics in the state, preparing for what that might look like. Next slide. This is just a plea to get tested. As you can see, we are seeing pretty high rates in our community of new COVID cases, especially as we head into school setting and more people being indoors and enclosed spaces. It's really important that if you have any symptoms at all, that you do get tested. This will help us prevent the spread of the virus, so that if you are positive, we know, you can take the appropriate precautions. We can let other people know who might have been exposed that they should be doing the same. It's also very important because we do now have the monoclonal antibody therapy that is a helpful tool in preventing people from developing serious symptoms that require hospitalization from this virus. That therapy must be completed within the first 10 days of your onset of symptoms. So it's just another reason, if you are ill, to please get tested. And just as a reminder, COVID still has a significant mortality rate, over 2%. That does make it 20 times more lethal than influenza. So testing, letting people around you know, is an important aspect of us containing this virus. And again, that monoclonal antibody therapy is a good tool to help address developing further symptoms. Next slide. There are lots of resources for that testing. Our local health departments are offering testing. Primary care providers very often are offering testing. Even some of our pharmacies will provide testing. If you have questions, you can get on the website www.michigan.gov/coronavirus and enter your zip code, and it will give you different testing sites for that. You can also call the Michigan COVID-19 hotline, or you can call our own Munson Healthcare Ask a Nurse line. I also do want to make people aware that we have launched a long COVID support group. So many of you have probably heard of long haulers, or there are other names for it, but people who develop sequelae from having COVID that last longer than we would initially expect. It is a virtual support group that will be held the first Thursday of every month in the evening. It is a Zoom meeting. We will have experts there that can share the latest information, as well as some practical guidance for how to address some of the most common symptoms of long haulers. You are required to have a referral from your provider. So if you do have questions about that or would like to learn more about it, you can ask your healthcare provider, or you can learn more about it on our website. And again, that website is there. And again, registration and a referral is required to attend this support group. I also want to address why the CDC recommendations keep changing. We do hear a lot of concern for people who are left sort of feeling confused or just don't understand what they should listen to. One time we said this, then you say that, and things are changing, and why is that? So I just want to address sort of in that space that as we get new information about this disease. Now, remember, this was a novel virus. It was one we had never seen before. And so when this pandemic started, we really knew nothing. So those changes in recommendations really should be anticipated and welcomed because it means we're learning more about the virus and learning more about how the virus impacts us. So the science develops and we are very quickly adjusting to what we learn from that. So that new information, that new clinical data, as it becomes available, the CDC and other organizations do update their guidelines and recommendations based on that most recent and validated science. So that's why we're seeing things change as frequently as they are. So as frustrating as that is, just remember, this has been condensed into a very short period of time, but we don't practice the medicine the same way we do today as we did 20 years ago, even, because recommendations change, our learnings change, and that is a good thing. We adjust to new information. I think it's important to remember that really the CDC exists to protect the health and safety of citizens and our communities, and they really are trying to address probably the biggest challenge we've had during this pandemic, which is we had very limited information and things are developing as we go along. And so please try not to be frustrated as changes are brought up. This really is something that we would expect. It's something that we see in medicine all the time. And we are revising and updating all of that information as we learn more about it. What this means is that there's a lot of studies going on and scientists are very focused on adjusting things as we learn more. And so guidelines will continue to change as we get more information, and that's a good thing.
Thank you, Dr. Nefsi. Appreciate hearing all those updates. We do have quite a few questions coming in already for you, but I'm going to save those until the other panelists have a chance to speak as well. But we'll have you back in a minute for the Q&A session. Thanks, Dr. Nefsi. Okay. Next, it's my pleasure to welcome Lisa Peacock, who is the health officer for the Benzie Leelanau District Health Department and the Health Department of Northwest Michigan. Lisa, it's always a pleasure to have you. Looking forward to your update.
Thanks, Diane. It's a pleasure to be here. So, well, the good news is that our vaccination rates continue to increase, although a little bit slower than we would like. We're seeing our biggest increases in the youngest age groups, so that's wonderful. One of our clear goals right now is to get as many school children vaccinated as possible. That is the group that has been eligible for the shortest amount of time. And we want them to be prepared to have a safe and healthy school year. So we're working closely with our schools on that, holding clinics on site and making it as easy as possible for parents to obtain that vaccination for their kids. So we have, we're getting closer to 70% of Health Department of Northwest Michigan residents 16 and over with the first dose. In comparison to that number, we're tracking at the state level that we're aiming for that goal of 70%. Although we also know that it would be good to have it higher than that. And Benzie Leelanau has reached and gone over that 70% level at 74.3% of residents 16 and over with the first dose. We do have some concerns. Certainly, we have seen an increase in cases being reported each day to our health departments. We've had a 200% increase in the Benzie Leelanau jurisdiction and a 400% increase in the Health Department of Northwest jurisdiction over the past month. So certainly cases are certainly coming in more quickly than they have been in prior months. That puts, our region, our state, and most of our counties in that high transmission level pretty consistently. Those are levels established by the CDC, and they go low, moderate, high, substantial, and high. The high level is the highest level that we can reach. And then just in other news, since the CDC and MDHHS issued their recommendations for vaccination, for masking in schools and for the community in areas where transmission levels are substantial or high. We've been concerned about the wide variation that we've seen in school boards adopting those policies across the board. And we know that they're facing lots of challenges and difficulties. And so last week we did make a decision to issue a public health order across both health department jurisdictions requiring masking indoors for students and staff and any visitors in K through 12 schools. And so the reasons for that are certainly the increase in cases and transmission levels that I have talked about, but also just last week, we really saw some additional strain, as Dr. Nefsey has been talking about, on our hospital systems. Both, Munson and McLaren play such an important role in our communities. And when their capacity becomes strained, that is a huge public health concern. And we are, trying to hold back the floodgates at the community level to prevent that strain from becoming unmanageable. And certainly, we know that schools present a risky environment for transmission when strict mitigation measures are not adopted. Last year, when we did have strict mitigation measures adopted all throughout the school year, we had great success across Northern Michigan in keeping students in school and learning. And so we are focused very clearly on that goal of keeping kids in school, being able to learn in person, avoiding any type of shutdown. And we need our schools to be able to have what they need to adopt those strict mitigation measures, including masking, until we can get those vaccination rates up and get our children and school staff and community protected. So I think that is all I have to say at this point. We just want to remind everyone that vaccination opportunities are broad and wide. You can go to either of our health department websites to access an appointment or information about a clinic that you can walk into. And I'm happy to be available for questions later.
Thank you, Lisa. And thank you for everything you're doing to you and your teams to continue to get people vaccinated, get information out, and to reduce the strain on our health system. So next, it is my pleasure to welcome back Dr. Jennifer Morse, who's the Medical Director of District Health Department number 10. Welcome, Dr. Morse.
Thanks. So we also are seeing about fourfold increases this past 4 weeks compared to the previous 4 weeks. Our percent positivity is up around 11% over our 10 counties, so some significant increases. All of our counties now are in the substantial to high transmission rate, which means that we do recommend universal masking in indoor settings for all individuals and in crowded outdoor settings as well to help prevent transmission. Our vaccination rates continue to creep up, but very, very slowly at this point. So we really do encourage individuals that are not yet vaccinated to do so to help slow down this spread in this most recent surge. We do have walk-ins for vaccination. We do recommend you call ahead just to make sure there is a nurse on site available to help you, and you can certainly schedule an appointment ahead of time. We do have pop-up clinics still available in the community, although those are fewer than they had been in the past. So all of our locations and information are listed there. Next slide. So I'm going to talk just a little bit about masking. I know there's quite a bit of confusion and unfortunately some controversy about this, but really there is a very, very large body of evidence that does support the effectiveness of masking to prevent COVID. That evidence has been gathered over the last couple of years, but pre-existing, there is a large amount of evidence supporting all types of masks, including fabric masks to prevent the transmission of viral and bacterial respiratory infections. It is true that studying masking is a challenging thing to do. It's hard to do a randomized controlled study. It is hard to do the perfect scientific study, and every study does have its own strengths and limitations. Understanding and interpreting scientific studies is extremely challenging, but when you look at the fact that there's dozens and dozens, up towards 100 studies demonstrating effectiveness of masks in both healthcare and community settings, and demonstrating that the proper use of masks pose really little to no risk to those that are using them properly. We really are confident in saying that masking does help stop the spread of COVID in schools and in the community. Next slide. So when we are recommending masking in school-age children, it is important that we do educate our children properly on how to use these, and that our education staff also help along with this. One thing is they do lead by example. And so if we are wearing masks and if we show good response to mask wearing, our children will do the same. If we are unenthusiastic about mask wearing or are really negative about it, our children will be the same. We should encourage our kids to wash their hands before putting on a mask, hold the mask by the ear loops, put it over their face, avoid touching the inner part of the mask, make sure it's covering their nose, mouth, and chin. A lot of concerns I've heard from parents is that their kids' masks get dirty and wet, and so therefore it's a risk to them. So really, we need to be providing our children with extra masks and encouraging them to change them if they're dirty or wet, and our educators really need to help with that as well. They should wash their hands before they take their masks off. Their masks, when they're not wearing them, should be put in a bag or someplace clean and safe. They should wash any fabric masks daily and not share masks with others. And again, if kids are anxious or nervous about this, just having them wear it during the day at home while they're watching TV, doing other things to help encourage them and make this a more comfortable thing to do. And there are numerous resources online that can help with this process. Next slide. So again, I probably don't even need to mention this, but the American Academy of Pediatrics, the CDC, MDHHS, the local health department, numerous medical professionals have strongly recommended wearing masks to help with a safe return to school, so we can keep our kids in school rather than having them homesick or in quarantine. It protects the person that's wearing them as well as those around the individual who may not know that they're infected and contagious. We do know that COVID can be extremely transmissible, especially the new Delta variant. So it becomes more important that we do these extra efforts to prevent spread and prevent school closures or student absence. We also know, based on what we saw last year, and again, due to previous studies, that masks prevent the spread of other illnesses like RSV, influenza, and other respiratory illnesses. We do have cases of influenza in the state. We're seeing more and more RSV, which both were quite non-existent last year. So there are additional benefits to wearing masks in school and in the community. So thanks.
Thank you, Dr. Morris. Appreciate that. Appreciate the update and appreciate all of the information on the efficacy of masks. I think that was really a good way to summarize all the different studies out there. So now I'd like to bring all of our panelists back by video and begin our Q&A session. As a reminder, if you're a reporter, you can submit your question directly through the Zoom. And if you are someone watching live on our Facebook feed, you can submit it directly through Facebook, and those questions will get to me, and we'll get to as many as time allows today. So the first question is regarding the FDA's approval, full approval of the Pfizer vaccine. Has the FDA's approval of the vaccine had a noticeable effect on vaccination rates in the area so far? And I think I'll ask Lisa Peacock from her health department jurisdiction if she's seeing an uptick in vaccination rates due to the FDA approval.
Well, so I guess what I can say is we are seeing an uptick in vaccination rates. I am not sure if it's due to the FDA approval or not. We certainly hoped that that would, increase the confidence of some who may still be feeling a little trepidation about getting vaccinated. So we hope that's part of the picture, but certainly there are other elements that could be part of that too. We've, like I said, been really working on trying to focus on our school age population getting vaccinated before school starts. And with the availability of the moderately to severely immunocompromised to get their third dose, we're certainly seeing an uptick related to that as well. So I think it's more a combination of all of those things than any one certain element.
Great, thanks, Lisa. The next question is for Dr. Nefsi, And you spoke about booster shots, and you did a really good job of explaining the difference between a booster and a third shot for immunocompromised. But in relation to just general boosters, if someone received their vaccine at a Munson Healthcare hospital, where should they go for a booster when it's available to them?
Well, it's a good question, and it's going to be a little bit different this time around, given we had this prioritization and a huge rush in demand the last time. So we are working on plans right now. We don't anticipate that there will be large mass vaccination clinics like we did the first time around. We think that now we have a lot of our primary care clinics have access to vaccine, and so doing it through your primary care clinic would be one way. The health departments will likely continue to have their vaccination clinics as they are set up currently. And then we'll also have our pharmacies around the area. So, I think that the first place I'm going to look is with my primary care provider. And we'll look at different ways to approach that depending on the demand and supply of vaccine.
Great. Another question is, who will be eligible for the booster? Do we have more information on that? And this question is specific to frontline healthcare workers. Will it be made available to them just like we made the original vaccines available to healthcare workers?
Right. Well, like I was saying before, that approval has not yet come through, and we are hearing some, I guess, different opinions about how people should be prioritized. So
Okay.
outside of the immunocompromised folks, there are a lot of people who feel like our long-term care providers and long-term care residents should be prioritized. Many people obviously feel like healthcare workers should be prioritized as well, and those that are over 65. So I think it remains to be seen how the approval goes for that booster. And again, as a reminder, it will be with a certain time period after your second dose. So as we learn more about the approval as that comes out, we'll let you know.
Great. Thanks, Dr. Nefsi. And we have quite a few questions coming in just about hospital capacity and the surge. So there's a few different topics. The first question is, are hospitals within the Munson system at the point of having to expand their ICU capacity for treating COVID-19 patients? And how stressed is the hospital system and staff at this time?
Well, I'll start with that last part. I would say our staff is very stressed. We have been dealing with this pandemic for a long time. It's difficult. We keep thinking, we're seeing the end, the light in the tunnel, and then, we're right back to where we were. So our staff has been working hard for a very long time. So they are quite stressed out. And I'd say disheartened in some ways about, what we are seeing. So as far as capacity, it fluctuates, but we are very, very busy. Summer is our busy time up north anyway. And so when you layer on that we're quite busy, we're a little short staffed, and we have COVID-19 going on, that is a little bit of a perfect storm. So we have some critical care units around our system that are at capacity. We are making some adjustments in staffing as well as in some elective surgeries so that we can ensure that we have the capability to, take care of those that are the sickest. We are adjusting, and it's a day-to-day challenge. But yeah, this is definitely impacting the hospital system, and I would say that's true across the state and across the country.
How are we doing on supplies? Especially with hurricanes and earthquakes and supply chain issues. And then we also heard in Florida that there was a oxygen shortage and water issues. So how are we doing here?
It's a great question. We are doing fine so far.
Okay.
We have been, we stood up a response to the personal protective equipment, specifically masks and gloves that you'll recall, at the beginning was a real issue. We have plenty of supply of that so far. We are fine on ventilators. We do hear about other supply chain issues from other places, and you mentioned the oxygen. We just did a check today. You know, we get our oxygen from multiple suppliers, so far that looks good. But again, we are also seeing the demand for oxygen go up quite significantly across the state. So this is something we monitor every day. And, you know, to your point, it could be, you know, some shipping container getting stuck, to a forest fire, to flooding. All of those things impact our supply chain. So we never know when things are going to happen. We are having all of a sudden a shortage of a particular drug we use to treat COVID-19 patients who are hospitalized. That is in very short supply that we just found out last week all of a sudden. And so we are monitoring that situation closely. But the supply chain issues continue to be a problem, and one that we address on a day-to-day basis.
And then one last question for you, Dr. Manefsi, before I switch gears and move on to the health departments. We know that the Delta variant is the most common cause of the surge we're seeing right now. And as kids are going back to school, are you concerned about a surge of pediatric patients in the hospital system?
Yeah, quite concerned, you know, especially if we learn from what our colleagues down south and in the Mountain West are going through. We would fully expect to have an increase in the number of children with COVID-19. I think we are already seeing much higher numbers of RSV. I think Dr. Morse quite eloquently put it, you know, the masking helps for more than just the COVID-19. We saw almost no RSV and no flu last year at all. We've already seen cases of hospitalized influenza in the state of Michigan. We are seeing an RSV outbreak across the country. So absolutely the concern as we go back to school, especially in those districts that aren't requiring masking, is that we could see a significant increase in the number of kids with name your respiratory illness, whether it's COVID or it's influenza or it's RSV or it's parainfluenza or it's metapneumovirus, you know, that all of those together or even just alone on top of an already stressed healthcare system could be extremely impactful.
Great, thank you, Dr. Nefsi. We'll definitely be monitoring that and keeping everyone updated on our current numbers. Next, I'd like to ask Lisa Peacock to comment on a couple of questions we have coming in. The first one is related to the vaccination rate and percentage rate. And the question is, why would the vaccination rate need to be higher than 70%? Is that because of the Delta variant?
Mm-hmm. Well, any of the doctors can jump in and help me with this question.
I'm only asking you because you mentioned it as part of your update.
Yeah. No, that's fine. Absolutely. You know, the 70% number was always a target of some sort. It really, you know, there's no known, as viruses are entities that move around and change and mutate. And so, you know, it really is impossible to know exactly what coverage rate we need to protect the population from COVID-19. But it has everything to do with how contagious the disease is and how, you know, how dangerous it is in terms of morbidity and mortality. And so as the virus changes, it becomes more dangerous in terms of transmission and how it can affect people through, you know, severity of illness. And so as the virus mutates, and now we know that it's, you know, mutated through several variants, and we have the Delta variant, which is the most transmissible variant that we've seen so far, we know that we need more people to be vaccinated to cover those holes in our population that are needed to protect the whole community. So I'll stop with that, but, you know, I know Dr. Nefsi and Dr. Morse are well-versed in that comment too.
Any other comments, Dr. Nefsi?
Yeah, you're exactly right, Lisa. The higher the infectivity rate of a virus is, the higher the immunization rate needs to be. So we know a lot about that from, say, measles, which is highly contagious, and you need about a 95% vaccination rate in order to prevent the spread in the community. I happened to be stationed in the United Kingdom when they had a drop in their vaccination number to under 90%, and they had some big outbreaks of measles despite a lot of people being immunized against it. So, you know, we had estimated that 70% based on that initial strain of the virus, which was not as contagious as the Delta virus. So now that we have one that's quite a bit more contagious, the need for vaccination rate is higher.
Great. Thank you for that explanation. That really helps. Lisa, and one more question related to your jurisdiction. Will the Benzie Leelanau District Health Department be adding any further recommendations and or order concerning the upcoming Ironman event? Assuming athletes are taking protective measures, the concern is with spectators and entourage and just the event in general. Do you have any concerns about that?
Yeah, so any large gathering of people presents some level of concern. When it's outdoors, it's always safer than indoors. But our team has worked with event organizers like Ironman throughout the past 2 years as they've been planning for those events. And, nobody wants an outbreak associated with their event. So they're really good about reaching out to us and running their safety ideas by us. So we'll continue to work really closely with those organizers to make sure that any event that is held in our jurisdiction is as safe as it possibly can be.
Thanks, Lisa. Another question for Dr. Nefsi. Can you comment on the COVID cases from those shedding that have been vaccinated? Are we seeing what we've been calling breakthrough cases?
Yeah, it's a great question. And we are, with the Delta variant, seeing an increased number of breakthrough cases. There were actually a couple of studies that came out from the MMWR actually this morning. And so what they found was, this is including the Delta variant. So, updating those numbers, as we had just talked about earlier in the press conference about how when we get new information, we update. That being in New York, they did tens of thousands of people and did a study and found that overall efficacy of preventing the disease is still greater than 90% and just sort of getting it. For hospitalization, it's still greater than 90%. So if you are vaccinated, you are still protected against getting ill enough to be in the hospital, which we've kind of been saying we thought was true all along. So overall, it's closer to about 80%. So we're seeing upwards of 20% of people who have a breakthrough case. Now, those might be asymptomatic or very mild diseases. A second study in LA showed about the same, between 20 and 25% of just overall breakthrough. But again, your risk being vaccinated of getting sick enough with the Delta variant to be hospitalized is still quite low. And so the studies that they did showed if you are unvaccinated, you're 5 times as likely than a vaccinated person of getting sick. And if you are unvaccinated, you're 30 times more likely to be hospitalized with COVID than if you are vaccinated. So still quite protective. Again, not perfect. And I think people will remember that, 95% we saw early on, we were pretty surprised at. That's quite high for a vaccine. It is not that high with the Delta variant, but is still good.
Thanks, Dr. Nefsi. So I think the message there is this will really help you. It may not help you necessarily completely avoid COVID-19, but it will keep you out of the hospital, which is should be of great concern for a lot of people. Dr. Nefsi, we have a couple other questions coming in, and I'll ask you to comment on them. If someone has a specific question about their specific health condition and is considering getting a booster when it's available, who should they talk to?
They should talk to their primary care provider. Your doctor knows you better than anyone. There is some leeway. The CDC did put out some good guidelines for what an immunocompromised person might have. But your physician knows you better than anyone and knows what medications you're taking, knows your medical history. And so I would always advise, if you have questions, especially specific to this vaccine or to whether you qualify for this 3rd dose, that you talk to your primary care provider.
And 2 more questions for you, Dr. Nefsi. Why isn't the vaccination rate given as a percentage of the entire population and not just those who are eligible for the vaccine? Isn't that inaccurate and misleading?
It's a good question. And there was some debate about that. I think you can probably find the numbers. You can do the math and include all those kids in there to get our true vaccination rate. But you're right. When we look at eligible. So we're really looking at how well we're doing at getting those who can be vaccinated. That's where that, anybody who's eligible and that percentage goes up. But you're right, from an overall, how we're doing as a country and as a community, it does make sense to include children in that, and they aren't in the numbers that we're seeing. You can find those numbers. We could probably do some rough math and present them at our next press conference. But that's a valid point, and one that is debated every once in a while.
Dr. Nefsey, I'm going to stick with you a couple more questions that I know you have answers to. So related to monoclonal antibody therapy, you mentioned that that needs to be done within 10 days of symptoms. Is it also available for people who are asymptomatic?
Well, it's one of those things that there's not an indefinite supply. So if you have a positive test and you meet the risk criteria, you are eligible to get it.
Okay.
So we're not doing it prophylactically right now. So, if you're high risk and whether you have it or not. So if you have a positive test, again, talk to your primary care provider. There are some guidelines about who's eligible for it or not. But if you are positive for COVID and you meet the criteria, you are eligible.
Thank you. And one last question for you before I move back to the health departments. FDA approval for children younger than, I think is the youngest 12 or 15 right now. Do we have any idea as school is starting, and we've just talked a lot about concerns about schools and maybe not masking and in-surge of pediatric patients, any hope on the horizon for immunizing smaller children or younger children?
Always hope. And, they are looking very closely. Part of why it's taking a little bit longer is they're looking at a smaller dose for children, 5 to 12, compared to what adults were given. So those studies are ongoing. There's a lot of hope that sometime this winter we'll hear an announcement about it. It will definitely not be soon enough to vaccinate kids before school starts, which is why the AAP and the CDC are strongly recommending masking for all kids because we have the vast majority of those school age kids aren't eligible for the vaccine yet. But we are hopeful that we'll hear something in this calendar year about that. And as soon as we do, we'll let everybody know.
Thank you. The next question is for Dr. Morse. Dr. Morse, we just want some clarification. There's someone who just wants to clarify, you spoke at length about recommendations for masking in schools and the efficacy of masks. Have you issued a public health order for indoor masking yet in any of your jurisdictions?
So the health departments that I work for, none of the health officers have issued an order.
Okay.
We've encouraged the schools to make their own rules as recommended by MDHHS so that they fit the needs of their school. But at this point, no, there have been no orders issued.
Okay, thank you. And Lisa, one more question for you. We know that the move to your public health order for masking, there's arguments against that as well. Any comments to those who think you should rescind that mask mandate in the schools?
Well, I just want to say that there's plenty of support for that as well, including overwhelming medical evidence that masking is effective. And like Dr. Nefsey just mentioned, all of the major leading public health authorities and pediatric medical authorities are strongly recommending that schools implement universal masking policies within their schools. And so we are trying to support our school systems and their ability to do that and implement that. And, at this point, I have no plans to rescind the order.
Great, thank you, Lisa. And we are just unfortunately out of time. There were a few questions we weren't able to get to, but we will try to track down some answers and update our FAQs as we always do. I appreciate everyone who joined us today. Before I get to my closing statements, I do want to just thank all of our panelists today, Dr. Nefsi, Lisa Peacock, and Dr. Morse. It's always great to have these updates and to understand what our current situation is. So thank you again for your time. I know how busy you are, and thank you for everything you're doing to continue this important public health work in our region. Just as a reminder, as Dr. Nefsi mentioned a couple of times, that if you do have questions, we do have our Ask a Nurse line open at 231-935-0951. It's a great resource if you're have a COVID-19 question, a vaccine question, or just a general health question. You can, that's a free resource. Just want to make sure, because it doesn't say on the slide there, but it is a free resource that's available to the community. Next slide. And just finally, you know, we do these press conferences to try to keep you updated. In addition to these that we try to have about every 2 weeks, I'm not sure when the next one will be, just due to some scheduling conflicts, but we'll make that announcement as soon as we can nail down a date. But I do encourage you to sign up for our e-newsletter that gets distributed about every 2 weeks. Follow us on social media or visit munsonhealthcare.org for the latest information. Again, thank you everyone for joining us. Thank you, our panelists. Stay safe and have a great day.
Thanks, Diane.